Hi everyone, I'm Dr. Subhashini Katamalua. I'm a board certified preventive, lifestyle, and functional medicine physician. I often get asked the question, what exactly are lifestyle and functional medicine? So I wanted to take a minute to explain them here. Our conventional medical model in the US is essentially an acute care treatment model. If you have a life threatening acute issue like a heart attack, a stroke, a broken bone, or require emergency surgery, our treatments and expertise in the US are second to none. The problem comes when we try to apply that same acute care treatment model to chronic lifestyle driven diseases. Since acute care is really meant to treat and stabilize short term, urgent, and often life threatening issues, when we apply that approach to treating chronic disease, we end up oftentimes superficially treating symptoms and the underlying disease process continues to progress, which is why symptoms often recur. This is why, unfortunately, for many people, they end up on more and more medications and higher doses of those medications as they get older. This is where lifestyle and functional medicine can really complement and elevate our care. Where our conventional medical model is very reactive, lifestyle and functional medicine are very proactive. Lifestyle medicine is a medical specialty that uses lifestyle interventions as a primary way to prevent, treat, and in some cases, when applied intensively, even reverse chronic disease, including type 2 diabetes, obesity, and cardiovascular disease. It focuses on addressing the 6 pillars of lifestyle medicine: a whole food, plant predominant eating pattern, physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections. It's estimated that lifestyle medicine can address up to 80% of chronic diseases. The American College of Lifestyle Medicine is the main professional organization through which medical providers complete their training, and board certification is through the American Board of Lifestyle Medicine. Now moving on to functional medicine. Functional medicine is a patient-centered approach to health that has 2 key features that I want to highlight. First, it focuses on identifying and addressing the underlying root cause or causes of an individual's symptoms or diagnosis, rather than treating only symptoms. Addressing these root causes allow us to actually change the course of the disease process, often allowing for regression or sometimes even disease reversal. A detailed history from birth to present, dietary evaluation, and comprehensive lab testing are some of the tools we use to identify these root causes. Functional medicine docs often get a reputation for ordering a lot of lab tests. The reason we do this is because the root causes for most chronic conditions are multifactorial, and you only find what you look for. In addition to identifying root causes for current symptoms, lab testing allows us to identify imbalances that may exist for which an individual is not yet exhibiting symptoms, but they likely will down the line if they continue down this same health trajectory. I use functional medicine to support patients with a wide range of concerns, from metabolic diseases like prediabetes, diabetes, and obesity, cardiovascular disease, GI symptoms, autoimmune diseases, chronic fatigue, mental health conditions, and hormone imbalances. The second key feature of functional medicine that I want to highlight is the whole person approach to health. Functional medicine evaluates the person as a whole and takes into account the interconnectedness of our body systems and the fact that an imbalance in one body system often contributes to or causes an imbalance in another system. In medicine, we have a tendency to compartmentalize the body and to treat different parts of the body or systems of the body as though they're existing independently rather than being housed within one body. An example I often use to illustrate this root cause whole person approach is the functional medicine approach to mental health conditions like anxiety and depression. Current mainstays for treatment are typically therapy and medications. While these can absolutely be an important part of someone's treatment plan, for most individuals, there may be many underlying root causes for their anxiety and depression that are going unaddressed. We know that anxiety and depression may be in part due to gut dysbiosis, food reactions and intolerances, nutrient deficiencies, sleep dysregulation, hormone imbalances, chronic stress, and or toxic exposures to things such as heavy metals, pesticides, and mold. And more often than not, there can be imbalances in multiple of these areas. A functional medicine approach allows us to investigate, identify, and treat these underlying root causes, which often provide significant symptom resolution. As you can imagine, it takes a lot of time to gather all of this information and create a personalized workup and treatment plan for an individual, which is why functional medicine visits are typically an hour to an hour and a half long. long. The Institute for Functional Medicine is the main professional organization through which providers complete their functional medicine training and certification. Many different types of providers can get certified in functional medicine, including physicians, so MDs and DOs, nurse practitioners, physician assistants, pharmacists, registered dietitians and nutritionists, health coaches, chiropractors, and naturopathic doctors, among others. And of course, we each apply the principles of functional medicine within the scope of our field. So if you're looking for a functional medicine provider, make sure you take a look at their training and background to ensure they're the right fit for the type of care you're looking for. In addition, I think it's important to meet with a provider before you sign up to start working with them so you can better understand their practice philosophy and also ensure that they have experience in addressing your specific health concerns. I require a free 15-minute consultation with any prospective patients before they start working with me for that reason. Lastly, I want to clarify a common misconception that I think exists regarding the use of prescription medications in the fields of lifestyle and functional medicine. Oftentimes, people may think that because we focus on a root cause approach that emphasizes a diet and lifestyle first treatment approach, that means we never prescribe medications, and that is not true. We definitely use medications when needed, and I feel very lucky and privileged to work in a time where we have access to life-saving medications. Medications can be especially helpful when someone is working on establishing lifestyle changes, because those lifestyle changes not only take time to implement, but it can also take some time to see the effects of those changes, versus medications tend to have a more immediate effect. Our priority as healthcare providers is always patient safety, and sometimes using a medication is necessary to ensure that. For example, when someone comes in with very high blood pressure or very high blood sugar levels. As a person is able to implement long-term diet and lifestyle changes, we often are able to lower the doses of their medications or sometimes completely remove them. And we do this on a case-by-case basis. For some people, though, staying on a medication long-term may be necessary. Deciding to change the dose of or stop a medication is something you should always do under the care of your medical provider and never on your own. So to put it all together, both lifestyle and functional medicine use evidence-based testing and treatment recommendations and can be used for both treatment and prevention of chronic diseases. I see lifestyle and functional medicine as a way to complement and enhance my conventional medical training and skill set. Put simply, it gives me more tools in my toolbox to be able to help my patients get better and stay better. I hope you found this helpful. If you have any additional questions, please leave them in the comments section down below and I'll do my best to answer them. And if you think someone else could benefit from viewing this video, please do share it. And lastly, if you're interested in working with me as a patient, please visit beforethescript.com for more information on how to get started.